Hi, my name is Shayla and I'm going to be doing a focused assessment on a patient with cirrhosis. This is Eric. He is going to be modeling a patient with cirrhosis. Alright, Eric, we're just going to start off by just asking a couple questions, see how you've been feeling. How's it been going?
Things have been kind of good. I've been more tired recently, but
Been really tired. Do you feel lethargic, fatigued, or just kind of sleepy?
kind of just fatigued, so I kind of just want to lay down, not
Okay.
do much.
Alright, and how about mentally? How are you feeling mentally? Do you feel confused at all? More confused than usual?
A little bit, just kind of out of it, but I kind of just put that towards me, just wanting to not do anything.
Okay. And how about, have you been feeling like you've been seeing things that aren't really there, or hearing or feeling things that aren't really happening?
A little bit, maybe not the whole seeing things, but
Mhm.
things have kind of felt a little weird.
A little unreal.
Yeah.
How about, have you been feeling any pins or needles in your fingers or toes?
I mean, not that I've noticed, kind of just been
Okay.
not really noticing things just because I'm so tired.
And then another thing that happens with cirrhosis is called asterixis, and it's the involuntary movement of your extremities. And how I'm gonna check for that by having you close your eyes and put your hands out in front of you like this, okay? Alright. So you just watch their hands for any involuntary movement that they might make, and that would indicate asterixis. Alright, thanks, Eric. While you're sitting up, I'm gonna just take a quick listen to your lungs. When I do that, I'm listening for decreased lung sounds, especially in the bases. I'm going to be listening to hear if those lung sounds are diminished, which would indicate possible difficulty with thoracic expansion, potentially due to ascites. Eric, have you had any difficulty with shortness of breath or feeling like you just can't get a good deep breath?
A little bit, but that's kind of, just kind of a pain in here.
Okay.
So, I don't know.
Alright, and that pain in here could easily be his liver, that right upper quadrant. Pain would indicate liver pain potentially. I'm just going to take a quick listen to his lungs. Deep breath. And as I'm listening in the bases especially, I'm listening for any decreased or diminished lung sounds. Okay, great. Alright, Eric, next I'm just going to have you lay down and we'll continue our physical assessment. So I'm going to listen to his heart. I'm going to listen for any dysrhythmias, extra heart sounds like S3 and S4. I'm also going to observe his jugular veins and watch for jugular vein distension, which could indicate hypertension and fluid shift. I'm going to do an assessment of his extremities, look for any potential edema. So I'll just take a quick listen to your heart, okay, Eric?
Okay.
Again, listening for S3 and S4 or any dysrhythmias, looking at his jugular veins. I'm going to feel his pulses, check for bounding pulses. Can I grab your wrist over here? Now I'm going to look at his skin and just look for any petechiae or bruising. Have you noticed any extra bruising, Eric?
Not that I've noticed, no.
How about bleeding? Have you been having any nosebleeds or bleeding gums?
Yeah, just nosebleeds more often than I'm used to. And kind of just when I brush my teeth, my gums seem just a little extra sensitive, so I've been bleeding a little more.
Okay. And then again, when I look at his lower extremities especially, we're looking for any fluid shift and edema. Eric's legs look great and not edematous at all. Alright, next I'm going to move to your abdomen. I'm going to listen to your bowel sounds. I'm going to push on your stomach. You just tell me if it's tender when I push.
Okay.
So I'm just going to take a quick listen to your bowel sounds.
That right there.
It's tender up here.
Yes.
Okay. So again, we're really watching for that right upper quadrant pain. Anywhere else?
No, that's just where it seems most tender.
Okay. Have you been nauseous lately?
A little bit, yeah. Just not really wanting to eat too much.
Poor appetite.
Yeah.
That is a pretty common symptom of cirrhosis, is having a poor appetite. Have you had any unexplained or unintentional weight loss recently?
Not that I've noticed.
Okay. While I was doing it back to assessing his abdomen, when I was feeling and assessing his abdomen, I'm looking for distension as well, potentially from ascites or fluid buildup in his abdomen. And then Eric, how have your bowel habits been? Have they been regular? Have you had any diarrhea, constipation?
I mean, it's been a little, I guess you could say irregular, but it's just kind of weird coloring.
Okay. What color would you say your stools are?
Kind of like a palish type gray.
Okay.
I don't know.
So cirrhosis and liver disease, you're looking for any abnormal stool, usually clay colored, so that white or gray colored stool. Patients with cirrhosis can also have diarrhea or constipation, so you just want to assess those bowel habits. How about elimination, urinary elimination? Have you had any difficulty with that? Anything abnormal?
I mean, it seems kind of heavy. It's been really dark.
Really dark urine?
Yeah.
Has it seemed thick when you say heavy?
Yeah, kind of just thick whenever I'm
Okay.
using the restroom or whatnot.
Okay, so you often see really dark amber colored urine. Sometimes it even seems kind of thick. And I think that is everything.